Every year in this country, somewhere between 10 and 12% of all births are to premature babies. That's why we're here at the St. David's Women's Center of Texas to talk to some of the staff here about what you can do to manage the situation if you happen to find yourself and your baby in a neonatal intensive care unit.
My job is to provide education and resources for our families as well as our nursing staff to make sure that the babies have the best possible outcome when they leave our NICU. One of the things that we really look at is the family dynamics and how are they coping with what's happening with their baby right now. And that's going to change every time we talk to them about a different diagnosis or every time we talk to them about a different intervention. Their coping strategies are going to change.
A baby in the NICU oftentimes has ups and downs, and that's just kind of like a part of the normal stay. Trying to take it easily and trying to take things as they come is kind of the best approach.
Things that we find that's unique to fathers rather than mothers is fathers want to fix it and fathers can't fix it. They are very used to seeing a problem, they have a solution, they're going to do it, it's a done deal. That doesn't happen in the NICU. Participating in the baby's care is the best way to help fix whatever is going on, and that is by changing the baby's diaper. That is by supporting the mom during breastfeeding time.
I think whenever you come in, just to try not to be too intimidated. I know that the machines and the new people might be something that's scary, but just know that we're all here to help you and your baby and ask to participate in the baby's care, helping us keep an eye on the baby, changing the baby's diaper, doing daily activities with the baby, holding the baby.
So one of the things that we really talk to them about is coming in at the time that the baby has awake time, and that's with feedings, diaper changes, giving medications, things like that, where they're really able to participate in the baby's care and not just sitting at the bedside watching a sleeping baby. You know, sleep time is healing time for us in the NICU.
Get some rest and, you know, maybe just have some time, especially if you have other children, like spend some time with your other children. And I think the nurses are pretty good about telling like whether or not the parents are coping well.
I think one of the things that also is difficult for fathers is if there's any financial situations, if there's any relationship concerns between the mom and the dad, if there's any friction at all with any family members. I think that sometimes that brings out some frustration as well. So we hook the parents up, mom and dad, with case managers and social workers.
Kangaroo care, that's something that often promotes bonding between dad and baby and mom and the baby. I know both parents love to do it and the babies benefit from it quite a bit.
We do a lot with touch therapy with kangaroo care. So that is something that we encourage as soon as the baby's able to tolerate it. We have the dad take off his shirt, lay the baby directly on the dad's skin to skin. We put a blanket over both of them and then we back off. One of the things that we wanted to provide for our parents is a place to go for some respite, a place where they can go without the bells and whistles of the NICU, a place where they can go when the physicians have to do some sort of procedure on the baby that wasn't a cold waiting room. We wanted them to be in a very family-oriented environment, a homey, cozy place where they can sit down with other NICU parents and talk about some of the issues that they all face in the NICU, have computers readily available for them to look up anything that they want to. The Ronald McDonald volunteers are fantastic to make sure that there's always beverages, that there's snacks provided. It's just a phenomenal place for them to be able to go and kind of get away from the stress of the NICU environment.
Our thanks to our sponsors, Baby Bjorn, whose front carriers are inspired by the great benefits of kangaroo care and premature babies. We also want to thank the staff here at St. David's for allowing us to visit their NICU. If you've got thoughts on premature babies, please join us at DadLabs.com. We want to hear from you.